Professor Sam Phiri. I'm the Executive Director of the Lighthouse Trust at Kamuzu Central Hospital in Lilongwe in Malawi. So I'm a clinician and a clinical epidemiologist, and the project which I work on actually looks at is a Center of Excellence for Integrated HIV Prevention, Treatment, Care and Support. So we actually, with our services, because we do service delivery, we do also model interventions and operations research and capacity building, which is training. So our ESTHER actually collaboration is the partners in Europe are University of Heidelberg in Germany and University of Cologne. And our focus, we call it Cologne Lighthouse Partnership. And basically, we looked at what are the needs for us as a partner in Africa. And our needs were that since we have a mature cohort for people living with HIV who are on antiretroviral drugs, our needs were really to look at trainings for advanced HIV management, and also to establish ourselves with a capacity to conduct operations research. And later on, we felt that we can be able to share experiences between the partners from the north and the south. So in that case, like experts, junior faculty from University of Heidelberg and University of Cologne coming to Malawi, having exposure. At the same time, also our faculty from Lilongwe, Malawi, to go to Germany to experience some of the issues within the institutions. So far, I think what I can highlight as the achievements, we've already actually achieved quite a lot in terms of the trainings which we've done so far through the ESTHER collaboration. And so the impact has been that our clinicians and nurses in Malawi are able to manage complex cases of HIV because of the advanced HIV management which has been there. And one other component is that we have been establishing ourselves as a Center of Excellence also for model interventions and operations research. Currently, we're doing a study which is a cohort to look at some of the side effects and some of the experiences we face with our patients on antiretroviral drugs using the new first-line regimen for Malawi, which is tenofovir, lamivudine, and efavirenz. And understanding that tenofovir can cause problems with the renal function, so we'll be actually observing our patients through that. So this actually has been quite a significant component. So in terms of collaboration and how the process has been going on, we actually have been sitting together, so among the partners, University of Cologne and University of Heidelberg and Lighthouse, to see what are the main needs which you would like to look at. So the highlights have been that so far so good that we've been at the same level like equal partners to look at that. Some of the challenges which I would mention that since we want to make sure that we do a lot of advanced HIV management, so one thing we can look at is that the infrastructure, for example, within the country for us to do laboratory work for some of the work for the cohort, some of those cannot be done in Malawi. So which means in that case, we are relying upon to send some of those samples to Germany for our partners. So it is an advantage because we are getting that access. But I think we need to look at the German partners were willing to actually transfer their technology to Malawi for that. But currently, the capacity in Malawi in terms of human resource, infrastructure, and also the equipment are not actually enough to do that. So we've done some of the clinical, for example, equipment like having like an ECG machine, a PIMA for CD4 point of care, and also looking at ultrasound. So these will assist the Malawi counterparts in order to manage their cases. But for the labs, will require a little bit more infrastructure and more resources, which currently, from the budget which we have on ESTHER, cannot be able to do that. So which means we have to open ourselves to make sure that other partners can be able to pull in more resources, either through ESTHER or through other mechanisms for us to make sure that we have our lab capacity to come up to speed for us to be a center of excellence for the operations research and make sure that we are able to manage, do the lab work within the country rather than to transfer to Germany for that of the components. So that's what I can mention. And for the ones who are planning to go into collaboration and partnerships, what is key is really to make sure that before you go any further, it's better to sit down the northern and southern partners right at the same level to understand what are the main needs, because the majority of this would be in the southern part. And then you may have some skills in the northern part, but then you need to see what are these going to be used in the southern part. And also, how effective and also what is the efficiency gains which the southern part would get from the people from the northern part. So what we've learned so far, for example, is that the faculty who would go to, for example, in this case from Germany to Malawi, the people who would understand already what actually the capacity and the needs of Malawi are. So in that case, the southern partners, what the capacity, because they may start to teach things which may not be relevant to those countries. So I think you're making sure that they are planning together. And also, on a regular basis, communication is really very critical to make sure that the southern partner and the northern partner are really communicating effectively to make sure that if any of the partners is able to see some issues which are required to be developed, or there are some challenges, you should work together as a team to make sure that you do that process. So that's what I can really mention about this. And if you're ready to move into a partnership, I think it is great. And on top of that, also to make sure that there's a south-south, whereby some of the partners, for example, the Lighthouse in Malawi, can be able also to get some other partners. For example, we actually work out on another partnership, which is the International Epidemiological Database for Evaluation of AIDS in Southern Africa, whereby, for example, the Lighthouse and some of the centers who are also under ESTHER, like the New Orleans Clinic in Zimbabwe, we're already in that partnership. So that can continue, even through ESTHER, to continue the partnership in that South collaboration, which can be supported also by the ESTHER country partners in the North. So resources will be required. I must admit here, I don't think that even if the government of Malawi is able to commit some resources to, for example, HIV management, without external support, I don't think that Malawi would be able to maintain, for example, the over 500,000 people who are alive on antiretroviral drugs in Malawi without external support. So more resources would come in, but of course, efficiency gains would be available to make sure that we manage the little resources which are available efficiently to make sure that we have good outputs. That's what I can mention about this.